Welcome to Let's Talk Antigonish, the podcast where we sit down with neighbors, experts, and friends to explore the stories, the questions, and the big little issues that shape life in our town, one conversation at a time. This week, we're talking about awesome new changes to how pharmacies function in this province. It's good news for everybody. Hello, everyone, and welcome to Let's Talk Antigonish. It's just me, Justin, because Anuj is off in India yet again, abandoning me, where it's nice weather, and here we're dealing with another snowpocalypse, as always. So this week, we're going to talk about pharmacies. Pharmacies, because there's an important new thing that has happened as of the 1st of February in terms of what pharmacies can provide for services, and not everyone understands and knows that. So I've got two experts here. I'm actually on site at the Teasdale Apothecary talking to the owner, Miranda Teasdale. Hello, Miranda.
Hi, Justin. Thanks for having me.
Thank you for inviting me into your office here. Very nice office, I have to say. I feel very comfortable. And then Marcel Vandenberg. Oh, Marcel, who also happens to be my brother-in-law, and pronouncing his name in an atrocious accent hurts my soul. So I'll say it right. Marcel Vandenberg.
Yes, that's the correct way to pronounce it. That's nice being here, Justin.
Yeah, and you're here because, Miranda, you're the owner of this apothecary, of this pharmacy, and a pharmacist. And Marcel, also a pharmacist, a relief pharmacist, but also a member of the Nova Scotia Pharmacy Regulator. So you, sir, know an awful lot about how pharmacies function in this province. So you're an expert pinch hitter.
Yes, that's correct. And I joined the board of the Nova Scotia Regulator as of the 1st of January this year, in an amazing time.
Okay, so can somebody then explain to me why I'm here, which is as of February 1st, something important has changed in pharmacy land in Nova Scotia. What is it exactly?
So what has changed as of February 1st is that the government of Nova Scotia is now paying for a lot of minor ailments that were available for pharmacists to prescribe medication for, but now everything is fully covered. So that gives a really good, easy access to healthcare for lots of Nova Scotians, especially here with our amazing pharmacies in Antigonish.
So that means you used to be able to go to a pharmacy and get help with some random ailments, and maybe you can tell me what those are. But before, you had to pay for it yourself, and now you're saying that the government is paying for that.
So for the last almost 3 years, this has been a pilot project called CPPCC, or Community Pharmacy Primary Care Pilot, or primary care clinics. And these were funded services in those sites only. So as of February 2nd, 2026, all of those minor ailments are funded in every pharmacy across Nova Scotia.
Okay.
As long as you have a valid Nova Scotia health card.
So there are a lot of minor ailments that are available for fully funding now, and it includes something like allergies, for hay fever, pink eye, cold sores, heartburn, skin rashes, eczema. Besides the minor ailments that were already funded by the government, like a bladder infection or shingles, or the treatment or prevention of Lyme disease.
So it was because there was a pilot project at this pharmacy. So essentially, the past 3 years, those things were also being reimbursed, and they've decided this has worked, and now the whole province is doing this. Every single pharmacy.
Exactly. So it has shown, based on the results of the pilot, that we have kept a significant amount of people out of emergency rooms, and even the regular doctor's office, if they have them, by being able to provide these service that is well within our scope. So they have opened it up province-wide for these services, which is really great because, as we know, there is a significant lack of healthcare providers and people are struggling to access care. So we're just trying to expand that access.
So how does it, so if, because as a regular person, I'm not going to know what those 26 are. And I'm just like, okay, I've got a rash and I'm like, I don't necessarily want to go to the ER. Am I supposed to just walk into a random pharmacy and be like, can you help me with a rash? Or like, how does it work? What am I supposed to do?
So, a great first point is always just calling your pharmacy, whatever pharmacy that you deal with. If you have one, just call them and see if they can help. And if they can't, because a lot of them, even us included, a lot of times we aren't able to treat walk-ins just because how busy we are in the dispensary. But we definitely always try and provide same day or next day service. So again, that might be different in your pharmacy. So it's always best to call first. Or if you are really stuck, calling 811 is a great option. They will help triage you, and they can even help you book an appointment at your closest pharmacy as well.
Okay, so why would I, in a sense, want to go to a pharmacy if I have a family doctor as opposed to my family doctor? And this makes total sense if you don't have a family doctor. But what if you have a family doctor? Why would I choose a pharmacy over my doctor? Just because it's easier to get an appointment, or?
I think what we want to do there is we want to work collaboratively. So for us, practicing to our full scope, if I can confidently help someone with their hay fever allergies, it saves that appointment at their doctor's office for someone a little bit more complex. That would be, someone we wouldn't be able to help. And we always keep the physician or nurse practitioner up to date. So anything that we do in our clinic or in the pharmacy, if that person has a family provider, we send them a record of it. That way their chart is always up to date.
Okay, so you've been doing this for 3 years here. What are the most common reasons people pop in for these sort of services? Like, what's the number one?
So I would say, honestly, prescription refills for those folks who don't have doctors or providers or who can't get in to see their provider. And then I think the minor ailments kind of change seasonally. So we see a lot of allergies and skin rashes in the spring and summer, and eczema flare-ups in the winter for sure. And then at certain times of year, we see a lot of strep throat. What about you, Marcel? I know you do relief in clinics and pharmacies all around the province. What do you think you see most frequently?
Yeah, I think you were mentioning it right. Like when spring is coming, hay fever is one of the most common minor ailments you see. And I would say it's really easy now to go into a pharmacy to get the right treatment for that, and also treatment that might be covered by your drug plan. So that's also a big advantage for customers. But what you also see is cold sore. That's quite common, and with children, pink eye. And what is so great about going into a pharmacy is the accessibility. It's quite easy to get in. Sometimes it takes a few days or a few weeks to get into your family doctor if you are a lucky one to have a family doctor. And within most pharmacies, you will be able to get an appointment in the next 1 or 2 days.
So if I have a pink eye and I come in and you're like, you can diagnose it, so you can say it's bacterial versus viral, does that mean you can also prescribe an antibiotic?
Absolutely. So we can recommend an over-the-counter treatment, or we can actually prescribe an antibiotic eye drop or ointment for you.
Okay. And this is a question we were talking about before we got on the microphone. So because you're the owner of the pharmacy, right? And so it might be like, oh, you are prescribing because you therefore want more drugs through this pharmacy because it's drumming up business. But it is not the case because, and this is the thing I think most people don't know about Nova Scotia, is that you aren't beholden to your pharmacy. You can get your refill absolutely anywhere. Is that right?
Absolutely. A lot of people say that it could be unethical for a pharmacist to be able to prescribe because it's promoting their own business. But absolutely, there's no obligation for you to get your prescription filled at our pharmacy. The way we run it is the clinical services is often run separately or independent of the dispensary itself. So whenever the pharmacist prescribes something for you, we ask which pharmacy you want it filled at, and we would send it to any pharmacy of your choice.
So you're functioning in that role like a family doctor. Like
Absolutely.
The family doctor doesn't care what pharmacy you're with.
Absolutely.
And if I'm with Walmart, for example, that's my pharmacy, but I come here because you happen to be open that day, you can say, all right, I'm prescribing an antibiotic, and then you can pop over to Walmart to get it filled.
Yes, we do that all the time.
Okay, that makes total sense. So there's no conflict of interest in that sense.
Not at all.
But this is another thing about, I'm diverging slightly from what's cool about this announcement, but refills in general. You were mentioning, and I don't know if people know this either, that if you can't get into your family doctor to get a refill for whatever reason, you can go to a pharmacy and the pharmacist can fill the refill or prescribe. How does that work exactly?
Yeah, so it is well within the pharmacist scope to renew your medication. And back in the day, it used to be like, oh, we can loan you 7 until you can see your doctor.
Okay.
But now the way it works is we fully become the prescriber. So we would do an assessment. Like if you're taking medication for blood pressure, we would get you to come in, we'd check your blood pressure, we'd ask questions about side effects or anything like that. In the clinic, we're able to order blood work that could be relevant as well if we feel that blood work is necessary for your refill. But regardless, we would take on the new prescription. So we could renew it for, 3 months, 6 months, a year. It depends on what we feel comfortable with.
Okay, so that's even for people who have a family doctor. You can get the refill here, and obviously you're in communication with the clinician.
Yes,
Exactly.
A pharmacist always informs the primary care provider, like the nurse practitioner or the family doctor, about what we did. Even if we are prescribing something for a minor ailment, we will inform your family doctor what we did, so that the file at the family doctor stays complete. What's new as well is that the scope expanded here in Nova Scotia, and in the clinics, the pharmacists that are working there are also able to diagnose some diseases like high blood pressure or diabetes, or they are able to help people with certain chronic diseases in managing that in a correct way. So that's something that is new. It's, by the way, it is open for all pharmacists in Nova Scotia. Only thing is that it's being paid for by the government only in the clinics at the moment. And that's the same for example, for ear infections or for a strep throat or a sinus infections. You have to have the competences for that. So that means that you have to do an extra course at a university like at Dalhousie, or for referral for blood work at the Saskatchewan University. But if you have those competences, then you are able to assess an ear and write for antibiotics for an ear infection, which is quite convenient if you don't have a family doctor, or if you don't want to wait for 6 to 8 hours at the emergency room.
Okay, so just to clarify, every pharmacy now can do all of these things, but not every pharmacist is necessarily trained at this exact moment to do it?
Yes, that's correct.
Okay.
How it works in Nova Scotia is that it's competency based, so you need to have the competency. So everybody is allowed if you feel the competences. And like in the clinics and in the clinic we are here at Teasdale, all the pharmacists have the competences to do all these kinds of stuff because they have done all the trainings. But every pharmacist in Nova Scotia now can do that if they feel that they are competent.
So if you are with a pharmacy here in Antigonish, for example, and you're like, oh, interesting, I'm afraid I have diabetes, I will pop over to my pharmacy. You're saying maybe call them first to see if they have someone trained at that pharmacy to deal with it. Is that right?
Yes, and especially for diabetes, you have to do some blood work for that, and at the moment only in the primary care clinics, the pilots from the government, pharmacists are allowed to send you with a referral to do some blood work.
So do you know off the top of your head which clinics here in Antigonish would be ones that have like the full scope? Is it just Teasdale?
So Teasdale has the full scope, but we have amazing pharmacists here in town who are able to do strep throat, who can do dose adjustments in diabetes medication, but it really depends from pharmacist to pharmacist. So check with your own pharmacist to see if they're confident in doing that.
Interesting. And you can refer people. You can order blood work. You can refer as well. Like, what's the scope of referral? Like, can you refer someone to a psychiatrist for some? I imagine not.
Unfortunately not.
Okay.
We can really only do blood work at the moment. We can't do imaging or to other specialists.
Okay.
We do have access to a nurse practitioner at the moment who can help with more complex cases or patients that might be out of our scope, but that's for folks without a family provider. But we are unable to refer for imaging or specialists at the moment.
Okay, so if I sort of already asked this before, but let's say you have a disease, you're saying call your actual pharmacist or 811, and they will know all this information. They can say you can go to this pharmacy or not that one, or we can do this but not that. So it's up to us to sort of have that relationship with our pharmacist? Is that the key?
I think that's probably the best place to start for sure. Because as Marcel explained, the scope for pharmacists is really broad in Nova Scotia now. It's actually one of the most expanded scopes in the whole world. But it is an individual pharmacist base. So not all pharmacists may feel competent to diagnose somebody with diabetes.
Yeah.
So because it is so individual, it is best to check with your team first.
And so the two of you have seen this evolve over the past 3 years. Like, do you have any data or information on the extent to which it has helped with our emergency room here in Antigonish, for example? Like, has it reduced?
Yeah, and I don't have the results for Antigonish in particular, but in emergency rooms in general in Nova Scotia, the last report they did in the study was over 10% decreased in like the in emerge visits.
Okay.
I think, or was it actually more than that, Marcel?
Yeah, and that was only in the first part of the pilot. So with the data of the half of the pharmacies that are having a clinic now. So if you look at the data now, it must be way more.
So Marcel, in terms of the future, where would you like to see pharmacies headed in terms of expanding scope, and where do you think it's most likely to head? Like, what is the future of this kind of program?
Well, what I really like in working in Nova Scotia, and well, as you know, I'm originally from the Netherlands and worked in lots of European countries in pharmacy business, is the way how pharmacists really can make a difference in the healthcare of people. And one of the best examples of that is the way how our clinics are set up. That's really the future of pharmacy, where you can easily access a pharmacist that can help you out with lots of stuff in an easy, fast way, and takes a lot of the burden of the healthcare system away from busy ERs and from family doctors, and that's absolutely nice to be part of that.
And I know from knowing you as my family member, as my brother-in-law, you were pretty excited when it came to being able to vaccinate people, because that's not something you do in the Netherlands. You're not jabbing people with needles.
No, you're not allowed to do that. And here's just one of those things. And by the way, getting an injection in a pharmacy now is also covered. Not for all vaccines, but for example, for vitamin B12 or for the Depo-Provera, it's now fully covered. So instead of paying $20 for that, but some people had to do, you can now easily get your injections as well in a pharmacy, fully covered by Pharmacare.
And speaking of injecting people, what is the deal with the travel clinic? Because there's a travel clinic being opened, or you are a travel clinic, and you can get your immunization for travel abroad. What's going on there?
Yeah, so I have recently launched a travel clinic here at the Apothecary. So in the fall, I wrote a global travel exam. So I am a certified travel health educator.
Cool.
And basically, what a travel clinic is, it's a space where folks who are traveling internationally can come, and we discuss their itinerary. And it's not just vaccinations. We discuss other kind of medication preventions or mosquito-borne illnesses or any kind of illnesses they could pick up that could be food or waterborne, etc. I go through their medical history or any like risk factors like pregnancy or age related. I provide them with basically a pretty comprehensive report that includes prescriptions if necessary for things like vaccines that they would need, even like malaria prevention or traveler's diarrhea prevention, as well as all the important things like their healthcare access in that country, where their closest Canadian embassy is, etc. We're also a certified yellow fever vaccine site as well.
Cool. Are there other travel clinics in Antigonish, or is this the only one?
There was one.
Okay.
However, it closed a little over a year ago.
So this is it.
This
and
is
so
it.
How do you get into the travel clinic? Is it the same deal? Just call the pharmacy and ask?
Absolutely. So we have a full-time admin receptionist here, and you can either book online from our website, or you can call our number, and our receptionist would be happy to book you in.
So there's a lot of things happening at this pharmacy. Like, is it overwhelming at this point? Because I remember when it opened, and it was, I was one of the first clients. I'm like, this is a cool little place, but now it's just hopping.
I know, you were one of our first, Justin. Yeah, it seems like a lot has changed in the 4 years since we've been open, but we are happy to help. We've got a pretty amazing team here. I may be biased, but I love my team.
Sure.
And we are pretty organized. We've got a full-time receptionist who's been really, really, really helpful to manage all of our bookings.
Is this Annie?
No, it's Crystal. She's sitting
Crystal.
out there. She's
Okay.
Yeah, no, Annie runs the front store. We'd be lost without her.
But and when you opened, I remember the big thing at the time was that you were a compounding pharmacy, and nobody has any clue what that necessarily is. So could you just explain what a compounding pharmacy does?
Yeah, that's another piece that makes us a little bit unique. So compounding is basically customizing medication. So we come from a place where medication is not one size fits all the time. So what we do a lot is we make custom like pain creams for like topical application for folks who don't want to say take oral pain medications, or sometimes the topical might work better. Or I think about the kiddos or even adults who can't swallow pills. We can turn them into liquids or gummies. Or, I had a case the other day with a child who was nonverbal with autism and refused to take things orally. He needed antibiotics for an ear infection, and we were actually able to make them into a suppository form so that the mom could treat him without having to go to the hospital.
Okay, so it's different forms, but it's also different concentration of less of this and more of that.
Yeah, sometimes. And if there's a medication that you can't get the strength that you would want to be taking, we can custom make it into capsules or liquids or whatever to make it easier for folks to take.
And to add on that, so compounding is something that is in the scope of every pharmacy in Nova Scotia, but most folks don't realize that it can really help them. For example, one good example is when you are on certain types of drugs and you need to taper down when you want to quit. Sometimes that's hard with the commercial available strength. And what compounding can do is to make strengths in between the available strengths to help people to get off medication in a way better manner. And that's absolutely helpful for the public as well.
That's cool. And Marcel, as part of the Pharmacy Regulator, can you talk a little bit about what has changed in the past few years in terms of getting more pharmacists internationally to this province? Because I feel like I've read news reports where it's just we've now got way more pharmacists because something has changed. Is that true? That's
absolutely true. And there are two major things happening at the moment in Nova Scotia. So Nova Scotia is one of the only provinces in Canada that accepts the licenses of pharmacists that are being licensed in countries like the US, the UK, Ireland, Australia, and New Zealand. And when you are a pharmacist there, but you want to expand your scope of practice and want to move to Nova Scotia, it's just like transferring your license as if you were working in Canada, which makes it way easier. Like, I had to do a year of training, 4 exams to get my license approved here from the Netherlands. But those folks can come in a very fast way. And there are more than 100 pharmacists now that registered from those countries. And that makes that the lack of pharmacists here is getting less and less. One other nice project to mention is a project from the regulator together with Dalhousie University. It's the Georgian pharmacist group that has come to Nova Scotia. In Jordan, pharmacists have a high degree and are similar trained as in Canada. They have a PharmD, but some of those people are not allowed to work in Jordan, so they have more pharmacists than they can have on their license there. So the first group of 17 Jordan pharmacists came to Nova Scotia. They will go into a sort of internship together with Dalhousie University and will get their license as well in a fast track. And that not only helps them to bring in more good qualified pharmacists, but also give some people, some refugees, a better life here in Nova Scotia.
That's interesting. So, a Pharm D, that's a more advanced pharmacy degree. That's similar to what you had in the Netherlands, right?
Yes, and that's more or less the level that new grads from Dalhousie and in all pharmacies, pharmacy universities are getting at the moment.
Okay, so if you bump into a Jordanian pharmacist at this point, you'd be like, oh, that's going to be one of these super highly educated pharmacists. Is that essentially what's happening?
Absolutely, and they are well trained by Dalhousie to fit in the specifics of the Nova Scotian Canadian healthcare system in a fast way, so that they can stay here, and hopefully we'll get more of those people in.
Great. So just for clarification, I'm thinking back to the days of like a walk-in clinic when you could literally just walk in somewhere and be like, I need help, not like an emergency room style because you got a sore throat, some minor ailments. But the new pharmacy system isn't that necessarily, because you still have to make an appointment and double check that is that right? Do you get people who sometimes just have heard about this and they walk in and they be like, hi, I'm currently bleeding out of my arm, can you please help me, or so, you know what I mean? Like,
yeah, absolutely. I think it's important, like, obviously if you're bleeding out of your arm, a pharmacy is not the place to be.
Nope.
You should be in Emerge. But we definitely get people who come up and say, hey, I think I have an ear infection, or I think my kid has an ear infection, or I think I have strep, and they want to be seen immediately. We try our best to do same day service, but we definitely offer a lot of same day or next day, but we can't guarantee a walk-in appointment. Some pharmacies may differ. So absolutely, like I always say, to save yourself the trip, your best bet is to call first.
Yeah.
And call your pharmacy and see, hey, do you provide this service? Can you see me today? And then go from there. Just because I don't want to set you up for failure. If you come in and I can't help you until, 4 hours later, it might prevent you from getting angry.
And I think, isn't that, because I was talking with Michelle Thompson about this, the same day, next day thing, like we've sort of moved away from the walk-in system, and now you've got a slightly different system. This is for general clinicians, not and that's sort of what this is as well. Like you can't expect to just walk in and get served straight out of the gate.
Exactly. Like, I think pharmacies are known as being the most accessible healthcare providers, and we definitely want to provide help in any way we can. But I think with how broad our scope is and how much is on our plate right now, folks have to understand that we may not be able to help instantly, but we do try our best to help in a really timely fashion.
Sure. And I mean, to get an appointment with your family doctor can take a very long time. And so like, even for people with a family doctor like me, it can be faster to just, if you think you've got strep, but you can't go to the ER necessarily with that, but you want to be seen sooner than later, this is a logical place to do, but you still need, you can call ahead at least.
Exactly.
Okay. Mm-hmm. Great. All right. Well, I think we'll wrap it up there. I feel like we gave people an awful lot of information, but it's vital to understand because things are changing rapidly in Nova Scotia with the healthcare system. And this is certainly a big new deal, I think, for most people, especially in this town. And so I guess maybe you can give your final recommendation, but I would say if you want to know more about what your pharmacist can or can't do for you, literally just call them up and ask, because each pharmacy will have a different scope.
Yeah, and actually the Pharmacy Association of Nova Scotia launched a new website, or rebranded their website, effective with all of these changes. Oh. And they've got really great information on there describing all the services that are available in pharmacies in Nova Scotia too. So that's a great spot for people to check out.
We can share the link with the podcast as well, I think.
That's great. Yes, so I will put a link to that, and it's better to go there than on to Ask Antigonish and hope somebody gives you the right answer. As we always say, this will be all the information on that website. That's great. Well, thank you both for coming in. No, I came to you. I'm in your pharmacy. Thank you for allowing me into your pharmacy with these crazy microphones. And yeah.
Thank you for having us.
It's been fun.
Thank you so much, Justin.
All right. Bye-bye.
Thank you for listening to Let's Talk Antigonish. If you like the podcast, don't hesitate to subscribe. Just go to letstalkantigonish.ca and click. Voila! You'll receive new episodes right in your email inbox.
This podcast is a labor of love. Please consider making a contribution, small or large, maybe a monthly subscription. Depending on the level of public support, we would like to engage local producers and journalists to create more regular deep dive news stories about life here in Antigonish.
Right now, it's just Anuj and I doing this in our free time. You can read all about the podcast and ways to support us at letstalkantigonish.ca. And if you're a local business that wants to sponsor the podcast or even place an audio ad, we are certainly not opposed. A huge thank you to all of our subscribers and especially our paid subscribers, which have helped us to buy the audio equipment that we needed to get this thing off the ground. And remember to get in touch with us if you have an idea for a future episode or a burning question about life in Antigonish that you want us to explore and get answers to. We welcome all feedback. Just email us at letstalkantigonish@gmail.com. Let's talk, Antigonish.